Last night, we told you about the heroin and opioid crisis that's plaguing our country and our area. Tonight, in part 2 of our series, Lisa Sugart will sit down and interview a representative from Pathway to Recovery about services available for those living with addiction.
I am pleased to welcome back Eileen Panzarella. She is the Director of Prevention at Pathway to Recovery in the city of Hazleton. You were talking about the problem and how Luzerne County has the highest rate in the country for overdose deaths, which is unbelievable. But today we want to focus more on how people can get help. And if they give you a call or reach out, there is help available.
Yes, so if they give us a call, they'll be brought in. One of our counselors will do an evaluation. Through the evaluation and also talking with the client to find out do they need an inpatient rehab, and then we will work to find them a place where they can go inpatient, because that's one of the things too. A lot of beds are taken, they're limited, so we will work to try to find them an inpatient unit. If they don't need that high level of care, if they just need an outpatient, they can come in and see a counselor. We also have what we call partial hospitalization, which is an intensive outpatient. They come in 3 days a week and they attend meetings, group sessions, and so it's more intense, but they're not put inpatient. We can, recommend also, one of the therapies right now is counseling in combination with Suboxone. So Suboxone is a medication that blocks the cravings for heroin, and there are many doctors in town that are prescribing it. And so people are getting that, but we really recommend counseling with that, because they have to learn how to deal with their addiction. It is a disease, and learning how to deal with it, not just blocking the cravings. So the combination, Suboxone and counseling, can be successful.
And you told me something which I wasn't aware of, that oftentimes there is an overdose death after they've gone through rehabilitation. Explain why that happens.
Well, when they're coming out of rehab or out of jail, they have been off of heroin for a while. And if they relapse, if they go back to old patterns of behavior and they use again, that is one of the riskiest times, because their body is not used to it. And if they go back to using what they were using before rehab, they can overdose easier. And so it is a more dangerous time. They have to be aware of that and try to stay away from those old patterns of behavior.
I would think that's probably a very difficult process. Otherwise, we wouldn't be in the situation that we are in. What things can we do to help, like parents, to make sure their prescription medication is not, easily accessible by someone in their family?
Oh, definitely. Parents have to be aware. Keep your medication locked up away, especially teenagers who might be trying to get their hands on this to make them feel better, and grandparents too, because they might be more likely to have some of these pain medications around. So, and not just OxyContin, but Vicodins, Percocets, any of those. Know how many pills you have, be aware of it, and maybe ask the doctor, do you need to take that strong of one? And especially if it's being recommended for a child, is there something, a lower dose that they can use that's maybe not as powerful? So those are definite things. And if they're done with their medications and they still have them, don't just keep them. There's a lot of take-back places. The police are doing it, where you can give it in, turn it in, so it's not available for someone else.
And lastly, is it that people hesitate to get help? Is there still a stigma associated with it? Or has it just reached into so many families that maybe now it's more out in the open that people are not afraid to get help?
Yeah, probably both. There's still, I guess, maybe the stigma of that someone's a drug addict, but we know now it is a disease of the brain, and so it's not something that, are you embarrassed because you have diabetes, or if someone gets cancer, it's not that. So it's in the same kind of category. It is a disease, so they shouldn't feel that way, even though they might. But I think now we're trying to get more of that message out, that it is a disease, so less of a stigma towards it.
All right, well, thank you so much. This has been very informational. If you need assistance, you have questions, please call Eileen. It is Pathway to Recovery in Hazelton, 570-455-9902. Also, their website is pathway-to-recovery.org. Don't be afraid to ask for help, because that's the only way that they're going to get it.
Right, exactly.